Hello, it's Nina Reeves from Stuttering Therapy Resources, and we're continuing our ongoing series for the strategies that help children learn to ease their communication. Today, we're going to talk about light articulatory contact, and this is also known by many names like light touches, feather speech, lots of different names for the same exact thing, which is in the history of stuttering therapy, light articulatory contacts. And actually, I like that name, or light touches, or light contacts, because it describes exactly what this technique is. And that is the ability to touch our speech articulators together lightly, with less tension and less pressure in the muscles. Now, before I get into the lesson for today, and talk about light articulatory contacts, I want to remind you that we have an entire series of the speech handling techniques, but we really encourage you to make certain to watch the videos number 1 and number 2 first, the foundations and how to get kids ready for techniques, because launching into techniques without some basic knowledge and skills probably won't get you as far as you want to go, nor will it help the student be able to handle and manage their communication over the long term. So, as we start to talk about light articulatory contacts or light touches, I want to make certain that we all realize that this is one of those fluency enhancing techniques. This is meant to help increase the flow of speech, to put some fluidity and some fluency into the child's communication in a way that doesn't make it feel or sound weird. That's one of the things that kiddos really balk at, is that some of the techniques that we instruct them with make them feel and sound a little weird, especially at first. So it's our job and incumbent upon us to help them understand that when we first learn any technique, we learn it in a way that does feel pretty artificial. It's just like learning to play golf or any other new motor activity that isn't the norm for your body. And so it's going to feel a little weird at first. But as we grow and change and master the techniques, they're supposed to sound more like you and feel more spontaneous and easier. So, with that said, light articulatory contact is the best friend of easy onset of phonation, which is another one of our series of videos. And we say this because as we put together a light articulatory contact and an easy onset of phonation, they become soft starts. They become starting out the word easier, and we don't have to focus so much after a while on separating the two techniques. They become one. And I'll show you a little bit more about that in a moment. So, when I try to help my students who stutter discover light articulatory contacts, I really start with the idea that you can touch something together tight and heavy and tense, or you can touch something together light and with less tension and less pressure. And so we do a lot of minimal pair muscle movements. And I start out with tight muscles somewhere else in the body, like in the fists and in the arm, and we tighten our muscles and then we loosen them up, and we feel the proprioceptive difference in a tight muscle versus a loose muscle, starting with some bigger muscles because it's easier to feel that way, and then of course moving around to the speech muscles. So for instance, saying the word baby, 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 and feeling that difference. Baby, baby. And then I, as the speech therapist, am going to flip around the articulators, and I'm going to make sure that we're touching our tongue to the back of our throat together tightly. Cat, cat, and then lightly. And then lips, tongue, teeth, all of that without having to explain all of that to a young child. They don't need all of that information. They just need to feel the difference between tight and light muscles. Okay? So, after that, I introduce the idea of light articulatory contacts. And this is when we really get to play around with feeling things together lightly. Pencil, table, dog, go, ocean. That was my vocal cords going together lightly. And so this is all about feeling where we are tight and where we can loosen up our speech muscles. That's what a light articulatory contact helps with: increasing the flow of speech, decreasing the tension and struggle. So now you can see maybe how well this pairs with easy onset of phonation. Because when I go pencil, notice I didn't do pencil. I didn't do a light touch and then a regular onset. It was blended together. And when I do every, it's not every. I'm not trying to make just the contact here light. I'm making the entire beginning onset of speech into an easier muscle movement. So every, ocean, baby. And so that helps the children understand that they don't have to try to figure out, what words do I put a light contact on? What words do I put an easy start on? You don't have to think that much. You don't have to do all of that verbal gymnastics. It makes kids not want to use their techniques, I'm telling you. And so we want them to feel that forward flow with less physical tension, but not relying on trying to figure out which technique. It's start out easy. Okay? So I hope that makes some sense. And I think that this is a great way to help children learn to get that forward flow a little more in their talking. And of course, after we learn light contacts and pair them with easy onsets at the word and the phrase and the sentence levels, we keep going up the hierarchy of linguistic complexity. And so obviously, we're going to not expect a child to use a light touch on every single word they say. So it wouldn't be anything like, babies are fun. No one wants to talk like that. And you have to think about this. If you had someone instructing you to speak like that, would you do it? Obviously not. So this is meant to start out the utterance easy and let the rest go. So it's, babies are fun. They need lots of love. Do you see how that becomes more and more natural over time? We just want to increase the flow a little at a time and then help children carry this over and generalize it into into longer utterances and then into different speaking situations. Because this is pretty easy in therapy. We have to help them take it on the road over time. Now let me try to sum up what we talked about so far. First of all, we have to set kids up for success. So they need to know some basic knowledge and skills before we ever layer on speech handling techniques like light articulatory contacts. And when we talk about light articulatory contacts, we have to help children understand the proprioceptive difference, feel that difference between tight and loose speech muscles so that they can understand what a loose muscle feels like when they do a light touch. Third, make certain that this technique and all the techniques are not used to not stutter. That message needs to be erased because children who stutter are going to stutter. And the techniques are not really there for them to not stutter. The techniques, all of them, are to help them handle and manage the fluidity of their communication to feel more spontaneous and a little bit easier. Not perfectly fluent, but easier. And light articulatory contacts help children do that. And fourth, where can you get more information? Well, of course, we have our School-Age Stuttering Therapy, a practical guidebook, which has in it every single technique we talk about here on these videos, with summary sheets, parts of chapters about why, how, when to use these techniques, and ways to help kids understand them fully, so that they can utilize them more appropriately and when they want to, and if they want to, when they're communicating. So please feel free to email us at info@stutteringtherapyresources.com if you have any questions, or if you want us to do other videos in this series that we haven't thought about yet. We look forward to your feedback, and thanks for watching.